welcome to my doctor show. My name is Purity Museo. Now, are you and your family getting all the vaccines that you may require? According to the World Health Organization, 1 in every 5 children miss out immunization, and now leading to about 1.5 million children dying every year from vaccine or related or preventable diseases. Now, every month of April, the week of 24th to 30th, it's World Immunization Week, which aims to highlight some of the protective or action needed to ensure that every person is really protected from vaccine preventable conditions. On the show today, our topic of discussion is immunization. We'll be looking at types of immunization available, especially in the country, and what may go wrong if you miss out on some of the vaccination. We'll be having a look at immunization for children and for adults at the same time. Feel free to be part of the show. Just ask us a few questions, and also use the number that will be displayed right at the bottom of your screen to call us live, or subsequently use the hashtag MyDoctor to talk to us on Twitter at Ebru TV Kenya and at Purity_Museo. And just before I could ask you to sit back, relax, and learn from the exciting show ahead, let's just have an overview of what immunization really entails. Take a look. Help us discuss in a little more detail what immunization is and how much services are available to Kenyans. Right now, we do have the head of vaccines and immunizations program in the country, Dr. Collins Etabu. Thank you so much and welcome to the show. We appreciate, and as the head of the program for vaccines and immunization, maybe I'll ask you to just give us a history of where we are as a country in terms of people availing themselves for the services immunization, and also the availability of the services to Kenyans as at now.
Yeah. Thank you, Purity, for this, and it's indeed a privilege to be here, to be able to speak to Kenyans on immunization. Before I go to the history, you realize from your, the preamble that immunization is really about getting our bodies to be able to protect themselves from diseases. There are two ways in which we get our bodies to protect themselves from disease. That one, we can allow ourselves to suffer the disease, and if we are lucky enough, survive it, or if we are not lucky, we'll be able to pass on. But then if we survive it, we may survive with a lot of other complications. We may be brain dead, we may be crippled, we may have other many complications, name it, pneumonia and so forth. But we have currently cheaper ways to prevent disease, and that is where immunization and vaccines come in. That somebody does not have to go through the suffering or the indignity of having to suffer disease outbreaks for them to gain protection. The immunization program in the country began in the late 1970s, around 1980. We are close to 4 decades old now. And at the beginning, it started with a vaccination against the 6 very traditional diseases, big diseases at the time, and that was tuberculosis, tetanus, polio at the time, and so forth. At the time, in the early 80s, immunization was for the privileged few. Not everybody was able to access immunization. It was in the high-end institutions.
Was it because of the cost of immunization or the availability of the services at that time?
Both the cost and availability. At that time, immunization was not free. So only the privileged few would access immunization. Later on, the ministry, the support of WHO, moved to make vaccines more available, and they largely targeted schools and children out there, and so many people started getting vaccinated, and so we were able to stem the spread of very infectious diseases like measles and so forth. So by the time we were getting to the 1990s, we had achieved what we call the universal coverage for immunization, where we had reached close to 80% of our children. So then the focus at that time shifted from getting to immunize a lot more to expanding the immunization services to more facilities, but now specifically to eliminating or eradicating some specific diseases. And this is where the story of polio eradication comes in. This is where the story of measles elimination, maternal neonatal tetanus elimination comes in. That we have been successful as an immunization program. We are now not looking at just protecting the Kenyan or the individual from disease, but we are looking at eradicating totally some of these diseases so that we can focus on other health issues. In our country, we have on average done well with immunization, about 4 in every 5 children receive their vaccines by their first birthday, but we are saying that is not good enough. Over time, as we move along, you realize that the 20% of the children that are missed, they constitute a significant enough population or group of individuals to be able to sustain an outbreak should it happen. And that's why periodically, to be able to reduce, to have that group develop immunity, we keep coming back to Kenyans with mass vaccination campaigns, that we have vaccines given in health facilities, but after a certain duration in time, we are able to do a risk analysis and estimate that we may have had a build-up of a certain number of individuals that may not be immune, and therefore risking everybody else. So we have mass vaccination campaigns. The immunization services in the country are provided free of charge. When I say free of charge, it doesn't mean that it's cheap, it's free. No, it is not cheap, it's very expensive. But the taxpayer, the Kenya government, bears the cost on behalf of all Kenyans. Overall, the country spends about 4 billion Kenya shillings every year on immunization, just procuring vaccines alone, let alone the salaries and the logistics of getting these vaccines given. Now, the vaccines are given through a network of over 7,500 health facilities, out of about 10,000 health facilities in the country. By this year, we hope that all the health facilities in the country will be able to give immunization, and we have put in strategies to have that done.
All right.
Now, the 7,500 health facilities are not only public health facilities. The government provides immunization free of charge through all public, private, faith-based and NGO health facilities.
And Doc, all you want to mean all immunization services are free of charge?
All immunization services are free of charge, as determined by a package of care. There are some vaccines that are recommended for you, that are recommended for children, that are not yet in the national vaccines and immunization schedule. Those ones are not free, and they're provided in the private sector, but those are very few. We provide about 13 vaccines free of charge to Kenyans.
Okay, and we'll be getting more, talk more about the cost effectiveness for immunization services. But just before then, let's now once again define what immunization is and make sure you really distinguish immunization and vaccine, because you are the head of vaccines and immunization program in the country. Someone may ask, are these two different terms, or what's the relationship between the two?
The two terms, vaccination and immunization, are different terms, but they're often used interchangeably. Vaccination is an event. Immunization is a process. Vaccination is an event in which I administer the antigen or the drug that is called a vaccine to an individual, either by the oral route through the mouth or by injection. We now have other new technologies where people put it in the tongue. But immunization is the process by which that particular individual now develops the protection. So in that sense, the two terms are different. But in the medical world, in speaking out to communities, those terms are used almost interchangeably. So yes, they could be used interchangeably to mean about the same thing. Yes.
And just help us understand why it's important for every person to ensure that they don't miss out immunization.
Yes, it is very important for a person to ensure that they don't miss out immunization, and this is why. If you do not get immunization, then you're at risk of contracting the disease against which we are immunizing. Now, like I said earlier, you could contract this disease. It causes a lot of debilitation, like people really get very sick, so you'd be down, you risk death, you risk disability. For instance, measles could leave someone dumb. Measles could leave someone with debilitating pneumonia. Measles outbreaks have been known to cause very many deaths. That's just one example of a disease. Two, by not vaccinating, you're not just risking yourself, you are risking the entire community. It is one of those things that if we don't do, you basically are risking everyone else. Or by someone resisting or refusing to immunize, they're risking the entire community. And if they immunize, then they're passing the benefit to the entire community. So for you being able to vaccinate, you are able to stop the transmission of disease in the community, the spread of disease in the community. Assume that you had a critical number of people vaccinated and another few people, small group of people are not vaccinated. If you have a disease spreading and they find a few people vaccinated, you stop the spread to even those others that are not vaccinated. So the benefits of vaccination extend between the individual to the rest of the community, not just the individual. 3, you need to vaccinate because it saves you costs. The cost of vaccination might be as low as $1, as 100 shillings. But the cost of having to deal with that disease against which you seek to vaccinate might be millions of shillings. For example, dealing with rehabilitating someone who is crippled, you have to factor in constructing buildings that now take care of their needs. You have to factor in physiotherapy and so many. It runs into millions of shillings against the cost of vaccinating, which is about 100 shillings. If you're looking at vaccinating again and the rest, the productivity, then by having people vaccinated and avoiding disease, people are more productive because then they spend less time away from work, they spend less time away from school, and they're able to be more productive. Their cognitive, their mental development for children is not as affected. They're able to focus much more on the studies and do better, develop into much more responsible individuals.
Yeah, and I'll ask you, when coming up with different kinds of immunization services that we have, what are some of the factors that are usually considered? Is it about the disease itself? And because I believe we don't have immunization program for all the diseases available in the world. So what are the specific factors that are usually considered that, you know what, I think we need, for example, immunization program for tetanus and polio?
Yeah, there are many factors that are considered. Now, I would also like to point out that they're not considered by me, the individual, the head of the program. We have a huge team in the background that does a lot of work. We have teams of researchers that work in the background. As a country, we have a whole independent team of the best specialists, professors, and lead researchers that advise the program in terms of the vaccines. So we have what we call the National Immunization Technical Advisory Group that advises the ministry in terms of vaccines. Overall, there are many considerations to make before we consider to introduce a vaccine into the program. Number one is we consider the magnitude of the health problem. How big is the health problem in the community or in the population? You probably want to target a problem that is of big magnitude rather than focus on one that is affecting very few people. So that consideration is done, and we go into looking at what the burden of that particular health problem. Number two, we'll look at the availability of a vaccine. You might have a health problem, a disease, but there is no effective vaccine available. So you can't then talk about vaccination. So do we have an effective vaccine against that particular health problem? Number three, as we consider to do that, we have to be able to assure the continued uninterrupted supply for that particular vaccine. So are we assured that we can be able to have an uninterrupted supply for that vaccine? By the way, we keep joking around in the immunization program that by the time we consider to introduce a vaccine, we have to be sure that we will give it every day, everywhere, to every available Kenyan to the end, infinity. So, or until two things happen, until we're able to eradicate the disease against which we are vaccinating, or until the world ends. But it never quite stops. That's why a lot of thinking goes into it. So we have to ensure that we have that supply. 4, we have to look at the proposed vaccination strategy. If we are going to introduce this vaccine, how are we going to do it? Does our strategy assure us that we'll be able to reach more than 80% of the Kenyans? You may have a vaccine, you may have an interrupted supply, but you don't have a way in which you can deliver the vaccine to reach as many people as possible. 5, you want to look at the cost effectiveness of the vaccine. If you're looking at that this is in relation to other health interventions, you may have an effective vaccine, it may be available, but it's not as cost effective. Look at the cost for treating a disease, for example, might cost 500 shillings, but the cost of vaccinating might be significantly a lot more. and yet you may not be risking a lot of complications and other issues. So you look at the cost effectiveness, not just at an individual level, but at a national population level, so to speak. And then, of course, there are other considerations that we look at in terms of what do we have enough support from the government of the day to be able to introduce these and so forth. So a lot of considerations go through it. Yeah.
So we'll be looking at the awareness for immunization programs, but just before then, Doc, just list for us the types or the kind of services or the types of immunization services we have or Kenyans can access right now. Then we can now break them down to immunization programs for children, for pregnant women, and also for adults.
Yeah. Thank you so much. Yeah, we have, like I said earlier, we offer about 13 vaccines in the national immunization schedule. These are free of charge. The burden of delivering them is shouldered by the government. Most of these are given to children, infants, by their before they are 2 years of age. So we have the vaccines that are given at birth, protecting individuals against tuberculosis and polio. Excuse me. Then we have vaccines that are given in the first 3 months of life. So at 6 weeks, as the mother comes back for checkup after delivery, we're able to give vaccines about to protect an individual from polio. We give a vaccine to protect an individual from the pneumococcal disease that causes pneumonia and meningitis. We give vaccines against rotavirus diarrhea, one of the leading causes of death among children. We also give vaccines against 5 diseases combined in one called pentavalent. This is against diphtheria, against whooping cough, against tetanus, it's combined, they are given to infants, against hepatitis B and Haemophilus influenza type B. We repeat the same when the child is about 10 weeks old, that's 2.5 months, and we repeat again when the child is about 3.5 months, that's 14 weeks of age. We give the measles vaccine when the child is 9 months of age, and we repeat the same at 18 months of age. So that constitutes our spectrum of routine infant immunizations. And if you look at these diseases, most of them are infectious diseases, infectious in that they spread very quickly among people. They're likely to cause a lot of death and destruction among individuals. In that, again, we have a vaccine that prevents against cancer. It's just that people do not know about it. Hepatitis B vaccine component of the pentavalent vaccine assists to protect against cancer of the liver. We have the tetanus vaccine that is given to pregnant women in our country as it is now, and it's given to pregnant women to protect them from transmitting or contracting tetanus and transmitting it to the baby during the delivery process. That is why we have to give at least 2 doses during the pregnancy so the mother is protected, because you can't assure in our setup that we will have very, very clean delivery processes. We also are moving to, from next year, January, to introduce a vaccine for adolescents to protect them from cervical cancer, which is largely the biggest killer of our, really the leading cancer in the country, besides breast cancer, really to protect our women. In the northern parts of Kenya, we're looking at introducing the meningococcal vaccines. This is to protect against meningitis, which I know most viewers have heard about, and which again causes a lot of complications, death and all that. But the form of meningitis we are targeting is the meningitis that happens in outbreaks. That is why we are looking at the northern parts of Kenya where the outbreaks are common. We're talking West Pokot, we're talking Turkana County, we're talking Wajir and Marsabit and Mandera up there.
Yeah, yes. And now we are getting to specifics. Let's begin with the infants. Yes. Doc, let's just talk about the vaccines or the immunization services available for infants in specific. For example, what type of vaccination do infants have to go through, and what happens if they miss out on that?
Yeah. So for infants specifically, they have to go through the 13 vaccines that I've talked about. in the course of life, the first year of life. If they miss out on that vaccine, remember, these vaccines target the diseases that have the highest burden within the first 5 years of life. If they miss out on those vaccines, for instance, in the first few years of life, they're likely to contract tuberculosis if you miss out on the BCG vaccine. They're likely to contract polio, a very serious disease. We may not see a lot of it nowadays because of the success of the program and the successive campaigns. If you will realize, in the days gone by, we had rehabilitation centers spread all over the country taking care of children that have been crippled by polio. Because we've immunized a lot, we've been able to stem that, and the rehabilitation centers are now being used for other things, to do reconstructive surgery and all that. It is very rare now to see a child crippled from polio. So if you miss out, we risk sliding back into that anarchy. If you miss out on the infant vaccines, part of the vaccines we give in the infant schedule, you risk contracting a disease called measles. Measles typically happens in outbreaks and spreads very quickly in environments where people are close together, school environments, in communities and all that. In the past, it used to come in waves, and they used to be very bad. I remember in the communities, they have their own names for these outbreaks of measles. The Luos probably call it Mayaka or something. So everybody has something around it. You miss out on that vaccine again, that we give, you risk contracting tetanus. Tetanus makes someone stiff, and you stop breathing, and you risk dying within a few days of contracting the disease. Actually, the fatality rate from tetanus is very high, beyond probably 50%. Yeah. If you contract it, you're likely to lose your life. So it is that serious. The other diseases, services we give, the diseases we protect against, is something like diphtheria, which is a respiratory tract infection. We've been having episodes of bird flu. Now diphtheria mimics something like that, but it is worse. We have whooping cough, a very terrible kind of cough with formation of membranes around the throat that stops children from breathing and largely causes death. We have hepatitis B, which spreads very quickly through contact with the body fluids of individuals. And again, if left unabated, hepatitis B goes on to cause liver cirrhosis and ultimately liver cancer. So you can see the services we give, they might appear on the surface like just vaccines, but we've been able to hold back the spread of very, very serious diseases. You're talking tuberculosis, you're talking measles, you're talking tetanus, you're talking diphtheria, whooping cough that have been wiped out people. You're talking hepatitis B disease, liver cirrhosis, liver cancer, and so forth. Yeah.
And we want now to look at, that's when we come back, when you talk about all these diseases, what are some of the complications that they have? And also another question that you will be requiring that you answer for us, for a mother or for a couple that has missed out on this infant vaccination that you are talking about. Are they too late? Let's say, for example, the child is 1 year old already and they have never had these vaccinations. Are they too, and they have had this information from you, how important it is? Is it too late for them to go back for the vaccinations? That's when we come back. My Dr. Shaw takes a break, but when we come back, this discussion continues. Do stay tuned. Welcome back to the second and the last part of the show. We are talking about immunization. Just in case you're joining us for the very first time, our guest on the show today is Dr. Tabu, who is the head for the vaccine and immunization program in the country. And I welcome you back to the second part, Dr. Tabu. And just before we went for the short break, we wanted to find out whether for a mother who is watching right now and they have missed out on the infant vaccination, and now they want, my question is whether it's too late for them to get these services for their children.
Yeah, thank you, Purity. It's never too late to protect your child. That's around to start with. That one, we schedule or we have the timing for those vaccines set, because that is the time, the most optimal time. That is the time, if we vaccinated, then we have the best results in terms of developing, the children developing the immunity. However, if a mother had their child miss out on the vaccines, and say the child is 2 years old, the child is 3 years old, it's not too late. They need to still be able to take their children to be vaccinated. They'll still be able to benefit from the protection. Remember, sorry, I didn't touch on this earlier, that the various forms of protection also, there's also that protection where we have the immunity to diseases passed on from the mother to the baby when the baby is in the womb, and the baby therefore is born with that immunity. So in the first few weeks of life, the first few months of life, the child may be protected. But at that time, as the child grows, the immunity that they acquired from the mother goes down, and hence this is the time we need to be able to get the child now to develop their own active immunity. This is where the vaccines come in. The most optimal time, we get the best results, say more than 90% protection if we stick to that schedule, give it at the recommended time. If we delay giving the vaccines will still be effective, but it means that may not be the most optimal time. The protection might go down a bit, but even with that less protection, say 80%, it's still something that will be able to keep your child from disease. So if a mother had their child miss vaccines for one reason or another, I would like to request that they take them to be vaccinated. A case in point is, for example, in our country, we had an unfortunate incident last year, where health workers were on strike for about 5 months. So several mothers had their children missing out on vaccines. And so therefore we're risking a lot of disease outbreak because of that event. So this year the government has gone out and put in place a mechanism to try get these children that were missed at that time. So we are having a rapid results initiative to be able to reach those children. We're having series of accelerated outreaches in collaboration with the county governments and the Ministry of Education, looking for all children that missed out on these vaccines. They are older, they're probably beyond 1 year of age, they're probably 2 years of age, but we still want to be able to protect them from these diseases. So similarly, any mother who has had to whose child has had to miss the vaccines, please bring them back. And
Doc, now let's talk about these diseases that you are talking about. You know, we have 13 different types of vaccination services, but what specific diseases are we talking about? Because a viewer may be wondering, why do I have, for example, if it's tetanus, why do I have to ensure that my child has been vaccinated against a tetanus? Let's talk about just a few of the common diseases that we have in the country and what implications they have once you're not vaccinated against it.
So we have talked about the 13 diseases, the diseases we vaccinate against. I'll start with the big ones that have caused us problems. We have polio, for example. Someone must ensure that they're vaccinated against polio, because if you're not vaccinated against polio and you contract the polio virus, it goes into your system, affects the nerves, and causes you to get paralyzed.
What's polio and how does it spread?
Polio is a viral infection. It is spread in much the same way as cholera. It's spread from when someone ingests or takes in its contaminated food, and the food may be contaminated by, fecal matter from someone who is infected. So water and sanitation again come in key. So if someone takes in water or food that is contaminated, or they have dirty hands that are contaminated, they take in the virus. The virus gets into the into the stomach or in the intestines, and it's able to penetrate the intestinal walls and get into the blood system. So when it gets there, it attacks what we call the motor neurons, the nerves that control the movements in our limbs, that's in the spinal cord. So when those nerves are attacked, we lose the function of our limbs, so we get what we call paralysis. And the paralysis is of sudden onset. It comes in a few days after ingesting this virus through contamination.
So once you are protected against polio, yes, does it mean once your body comes across such a virus, then you'll not be able to express the yes, symptoms of what happens?
Yes. So once you're protected against polio, once you have received the vaccine, it means that number one, your stomach lining and the lining of the intestines will not allow the virus to go through because you have immunity, you have cells within that lining that will be able to kill the virus should it present there. It means that the cells within your blood will not be able to allow the virus to circulate. It means that you are protected. It means that therefore your nerves will not be attacked. It means that you will not suffer paralysis. That's what it means.
All right, at least now I understand why it's important to ensure that my child goes for polio vaccination.
Yes.
Yeah, okay.
Thank you. So the other big disease we have is tuberculosis. So we give the BCG vaccine at birth to protect the children from contracting tuberculosis from the adult population. Tuberculosis in children is more severe than it is in adults. It literally stops the children from growing. It literally stops the children from thriving, from developing. This is a child suffering from tuberculosis will literally not grow. You'll meet a 15-year-old child and they look like they're 2 years. They remain that tiny. In children also, when they suffer tuberculosis, it comes with very many other sequelae or sort of like symptoms or complications. The tuberculosis primarily may go to the chest, so you have pulmonary or infection in the lungs, but it can also go to the brain. You have TB meningitis. It can go to the heart. You have TB of the heart. It can go to the bones. You have TB of the bones. And literally the child does not thrive, the child does not grow. And this was introduced because we have significant burden of tuberculosis within our adult population, especially fueled by the HIV epidemic that has made TB prevalent. So when the child is vaccinated against TB, it means that they are to a large extent protected from contracting TB from the adult population. Remember, the child will be cared for by the mother who is an adult, by the father who is an adult, or grandmother, or whatever in our society. Often it's difficult to tell who of these individuals might be having TB that is yet to show up with symptoms or so forth. So we need to protect our children to prevent such things from happening.
And once again, Doc, I'll ask you how now the vaccine protects the child, because this is airborne, protects the child from getting TB from maybe a caretaker or even a parent.
So it protects the child in that the child forms immunity within the body. So it doesn't shield the child might be able to, the TB is airborne, the bacteria might be able to get into their lungs, they might be able to breathe it in, but because they're immune and the immunity is within the linings of the mucous membranes and the blood system, once the bacteria gets into the body, it's able to be contained. It's sort of walled off, sort of like a capsule is formed around it and it's locked up in a prison somewhere, so it does not express itself, it does not cause disease. So that is what happens. So it does not stop you from inhaling that, but really it stops the bacteria from growing. It stops the bacteria from multiplying or spreading in the body by just closing it off.
At least now I understand. But now, earlier on, Doc, you mentioned that an infant or a child will have to go through the 13 vaccination center services, rather, I beg your pardon. But now, do we have, and you said you're going to introduce vaccination or immunization services for teens. That's
Yes.
what you said, because of the cervical cancer cases
Yes.
that are rampantly increasing in the country. Now, when a child gets all the 13 services, vaccination or immunization services, then is it a one-time, is it a one-time thing, or is it something that you have to go for it once again, maybe after some time, after a few years, or what exactly happens?
Thank you. Thank you for that. Actually, when I mentioned 13 immunization services, it means 13 services to protect against 13 diseases.
Diseases, right.
Now, the way immunization works, vaccines work, is that there are those vaccines which you can give only once. There are those vaccines which you need to give repetitively at intervals. For those that you can give once, it means that once the individual is given that particular vaccine, the body is able to develop a good enough immunity to be able to protect against disease. But there are those vaccines that we need to come back and give again and give again. What we almost, so that the previous dose of a vaccine literally prepares the body for the next dose of the vaccine, or you basically be looking at the next dose of vaccine as a booster. That if you get one dose of vaccine, you do not develop good enough immunity, that you need to get the subsequent and the next one for you to complete the schedule of vaccinations for you to have good enough immunity. So think about one dose as building up on the next dose as building up on the previous one for you to get better with immunity. Now, the other aspect to that is that sometimes you can develop immunity, but the immunity with one dose or two doses may not last you a lifetime. So for you to develop an immunity to last your lifetime, you may need to get subsequent doses so that your body is sort of like locked to have that immunity lasting you a lifetime. So that is the essence, that we boost the immunity in terms of strength, but we also boost it in terms of getting it to last a lifetime. For instance, we give the vaccination against TB just once, and that is enough. But for other vaccines like polio, for the vaccines like diphtheria, whooping cough, tetanus, you need to give subsequent doses. Now, the spacing of the doses is made in such a way that it allows the body time to process and be ready, be primed for the next dose. So, for instance, in the infant schedule, for polio, we give at birth, then we wait and give at 6 weeks. We give the body time, then we give at 10 weeks. We give it time again to get to a certain level, then we give it at 14 weeks again. So that happens. For diphtheria, whooping cough, and tetanus, again, the same. So if I look at it from the angle of the number of times someone has to come, or the number of doses someone has to be given, then it's much more than that. But the 13 refers to the total number of diseases that we protect against. In the country, we seek to make it very convenient for our caregivers and for our children. For instance, we don't expect you to come back 13 times. We try to deliver as many, most of those vaccines in one sitting, and the development of those vaccines is such that it allows them to be given together without interacting or without reacting, and getting to work together to get you the maximum protection. So first of all, we endeavor to give vaccines, as many vaccines as we can in one setting. For instance, at 6 weeks, we give close to 8 vaccines. We give a pneumococcal vaccine for pneumonia and meningitis. We give rotavirus vaccines. For diarrhea, we give diphtheria vaccine. We give whooping cough vaccine. We give pertussis vaccine. We give a tetanus vaccine. We give hepatitis A vaccine, and so forth. So we endeavor to give most of that area. Now, again, so that we don't bother our children with too many injections, the technology is such that we try to combine those vaccines in one, so that you're not getting individual vaccines for each of those diseases, but we repackage the vaccine so that when you're given one injection, that one injection has several vaccines in it. For example, the pentavalent vaccine has about vaccines against 5 diseases in it, all combined into one, to make it a bit very convenient for children.
Right. And Doc, allow me to ask you, moving on to the vaccines for adults, how do I know the last time, for example, when it's called, let me call it weaning, for example, when we grow up and we are no longer with our parents, so how am I supposed to tell which vaccines, which services I was able to get when I was little and which one I was not able to get then? How do I tell? Do we have some diagnosis for that? How do I tell?
Now, we would be able to tell by our documentation, unfortunately, not the diagnosis. Often, if you're looking at it from, and this is why, if you try look at it from the diagnostic point of view, if someone tested you to check for immunity against some diseases, they definitely might find immunity. But often it's difficult to tell whether your immunity came from the vaccine or your immunity came from the disease. So you may not be able to tell. But the surest way for us to be able to tell is that in the country we have a system of documentation that as we vaccinate children, we take down all their details. We have the documentation, the book, the mother and child booklet that the caregiver stays with at home, and the vaccines are recorded there, and the caregiver is supposed to show that the child has been vaccinated. Ideally, in the current establishment, we're encouraging mothers that as the kids grow up, as they become who we are, you're able to show pride by saying, you know what, I actually took you for vaccination. I took responsibility and protected you from all of these diseases. Kindly do the same to your generations. We also have that same record kept in the primary health facility, what we call a permanent register. It's permanent because it's there for so many years. We are currently moving to making that electronic in the sense that we want you to be able to access that information wherever you are, that 20 years down the line you can go to that registry and be able to retrieve your record and say, yes, it is true, I have evidence I was vaccinated against these diseases.
And let's talk about the overdose. Sometimes when you are traveling, let's say outside the country, and they require a certificate, you know, and you've mentioned that some vaccinations or some diseases you just need to be vaccinated against them just once. Let's say it's a tetanus and I'm going to somewhere and they need a certificate for that. Am I able to get from your record the certificate, or do I have to go for the vaccination? We have different centers in the country so that I get the certificate of what happens.
Yes, we're able to retrieve that record. However, most countries require that you go through vaccination afresh for you to be issued with a certificate. So you will not be issued with a certificate on account of the records. However, you'll be issued with a certificate on account of the current vaccination status, that you'll be required to be vaccinated afresh. The limitation to 1 dose or 3 doses is not for fear of overdosing. Remember, the principle behind vaccines is that you have the very, very minimal active component in a vaccine to be able to prime your body so that you can be able to protect yourself from disease. There are about 3 concepts that differentiate vaccines from other drugs. The concept of overdose. It doesn't quite happen. Even if you got 3, 4, 5 more other doses, it doesn't count as an overdose. Rather, it might actually be good for you because you're assured for protection. Number 2, that comes into the concept of what the vaccines is doing to our medical world today. You probably have heard of drug resistance to malaria drugs, quinine and all that, resistance to antibiotics. It does not happen with vaccines. We do not have resistance to vaccines yet. And so because of that, the vaccines are unique. And because of that, we urge vaccination so that they can protect our drugs as well from resistance and so forth, so that if the disease is not there, then we don't develop resistance as fast. Yeah.
And let me ask whether all the vaccines are friendly, especially for children, because many people, when you hear a vaccination or immunization week or something like that, the only thing that you think of is pain, that they are very painful. all vaccines, are they painful, or do we have the friendly ones?
No. The idea of friendly vaccines or baby-friendly vaccines is a myth. And I would look at it as a marketing gimmick that players in the market use to sell a bit of their product. You do not have any due advantage with using what we call a baby-friendly vaccine. On the contrary, you might actually be risking your baby by going that route. Remember, the vaccines are are made to elicit or to kick off a certain body response. So a bit of that discomfort, the pain we feel a bit of that fever we feel a bit, is largely part of the body's response to the small active ingredient in the vaccine that you have introduced. You would basically look at my body reacting, my body developing immunity, or so to speak. Pain is very minimal, is normally very mild. It's
Any
not
side
as
effect
debilitating.
as well?
We have side effects. They're very mild. Often you have a bit of small pain at the injection site. You have, in many number of circumstances, you have a bit of mild fever, hotness of the body around the time as the body reacts. But often it is not anything that would worry or necessitate a hospital admission. Once you expose the baby or tepid sponge the baby, within a day, the fever or pain should be gone. You don't have to do anything about it. If in extremely rare circumstances, it does happen, yes, that the fever is too high or it persists, you're urged to report back to the vaccination center and it is managed, and also that we actively document such instances so that we're able to follow up any emerging trends to vaccine safety. We have an independent body at the national level, National Vaccine Safety Advisory Committee, that deals specifically with that. And we also have the Pharmacy and Poisons Board that helps us with just checking the quality of the vaccines. Back to the baby-friendly vaccines and the bit of pain and a bit of fever. Often the temptation is that we work towards trying to make our children very comfortable. It is good. But it should also be known that part of the excipients that are perceived to make the vaccines more friendly, or that are perceived to make the vaccines cause less pain or reduce the fever, include maybe painkillers and things like those. Now, these excipients that may be added to vaccines may actually make the vaccines less effective. So that is why I talked about you potentially risking your child making the vaccines less effective by trying to interfere in the natural mechanisms of developing immunity.
Right. Yes. Now, just quickly, because we are winding up, you said that you are still working on vaccination services for the teens because of what you're talking about, especially for cervical cancer. But now for adults, do we have a few services for grown-ups? Because you said some of them you just need them in different times. For some, it's just once, and that's all. But for some, it's, you know, there are some intervals in which you have to go for the doses. So what are some of the vaccination services for adults?
Yeah, thank you. So we have vaccination services for adults as well. For instance, we give the tetanus vaccines to pregnant women. You can only be pregnant if you're an adult, largely so. We also have yellow fever vaccine that is given to travelers as you travel around to be able to protect us from yellow fever disease. We also have the adults largely needing other vaccines in special circumstances. For example, people who are bedridden, or the elderly, or the people who suffer from diabetes, or people suffering from cancer or sickle cell disease might need pneumococcal vaccine. The type of pneumococcal vaccine they would need in adulthood is a bit different from the one that we give in children. We also have influenza vaccine, but not yet in our program, that could still be given to pregnant women and other people at risk. Meningococcal vaccine, again, we still do give it to travelers as they go out there. Then we do have other emergency strategic vaccines that are given to largely adults, but even children also, that also come relating with the occupational hazards. For example, we have the anti-rabies vaccine that's given if you are bitten by a dog, or to dog handlers to be able to protect them because they're going to be in direct constant contact with dogs. We have the anti-snake venom, which is given to people who are bitten by snakes and all that. So we have that within our domain as well. We also considering the use of cholera vaccine, which again would be given to everybody, adults and children, in outbreak situations. But of course, the delay is because we're considering that the priority is to provide safe drinking water and having take care of our sanitation issues and so forth.
Right.
So there's a whole spectrum of vaccines again for adults, but we acknowledge that the biggest burden is borne by our children. And it's more cost effective to invest in our children than the older age group.
All right, Dr. Collins Tabu, thank you so much for making time for us. Quite a lot that we have learned today. We highly appreciate. Looking forward to having the same discussion someday.
Thank you. Sure,
yeah, and that's all the time we had for the show. Thank you so much for making time to watch, and thank you for your contribution. Remember, you can always download our previous episodes from our YouTube channel. Simply go to Ebru TV Kenya or Purity Museo and choose the episode of your choice. Thank you so much once again. I'm Purity Museo. Goodbye.